Hi everyone, welcome to a webinar on EnVision Centers, public housing agencies, and federally qualified health centers, opportunities for collaboration to improve resident health. My name is Bob Burns. I'm the director of the National Center for Health and Public Housing. Joining me in presenting today is Dr. Saki Malik Cho, our Director of Policy Research and Health Promotion. Before we get started, I'd like to thank a number of the folks at HUD who helped kind of bring a lot of these issues to our attention and has helped us in preparing for this session. First, I'd like to thank Jill Yu and Ramel Calderwood of HUD HQ, and Lisa Nowinski of HUD Region 3, and Jerlinda Banks of HUD Region 4 for inviting us and for giving us a whole bunch of help in putting this together. I should also note that our audience for today's webinar comes from different organizations of different types, including health centers, public housing agencies, EnVision Centers, HUD Region 3 and 6, and folks from other regions as well who've decided to join us, and HUD headquarters and field offices as well. Therefore, we're going to try to provide some background on health centers and EnVision Centers and public housing agencies for those who may not be very familiar with one or the other. Next slide. Before we go on, just a little bit about us. The National Center for Health and Public Housing, or NCHPH, or the National Center as we'll refer to ourselves, strives to improve the health outcomes for those who live in or immediately accessible to public housing. We do that by delivering training and technical assistance, research and outreach and collaboration services. We work directly with health centers and housing agencies to improve access to care, quality of care, and to ultimately improve health outcomes of public housing residents. We also work with local, state, and national organizations, like HUD, state governments, and state departments of public health, and housing agencies, and other partners. Okay, next slide. Before I go on, I should mention that the National Center is funded in part by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, but the opinions expressed and the information expressed is that of NCHPH and does not necessarily reflect the opinion of HRSA. Next slide. As far as the agenda, we've got really an awful lot to cover. This is a session that we have wanted to do for some time. We're doing it, in this case, pulling together housing folks and EnVision Centers and health centers really for the first time in this way, and we hope this will be the first of many. So today we'll be providing some background on the intersection of health centers and public housing agencies, and of course EnVision Centers, and the effort to improve health and wellness, and thereby the self-sufficiency of public housing residents. This agenda will include an overview of health centers, then we'll talk briefly about housing or the impact of housing on health, and of course EnVision Centers themselves. And then we'll spend most of our time regarding collaboration and opportunities for doing so, and also resident challenges. And then hopefully we'll have some time for some great discussion. So I hope you folks won't be bashful, either using the chat or speaking up verbally, and we'll get into how to do that a little bit later on in the presentation. Again, EnVision Centers is kind of what brought us together, but we have long been focused on the importance of health center and public housing agency partnerships, and we'd like to try to build that into to the goals for the session. Next slide, please. Okay. When folks registered, a number of you were kind enough to fill out a survey, and there you see some of the information on what people are facing with respect to EnVision Centers and partnering between health centers and housing agencies. And lack of funding, kind of consistent. COVID-19 has kind of bogged down and slowed down so many programs. Trying to keep partners at the table consistently, maintaining confidentiality, and a lot of people not sure where to begin. And I like that one in particular because in this session, we don't feel like we have all the answers, but I think we have some resources, and I think working together, we can improve the results. And we hope, and folks are hoping to gain strategies to connect and build partnerships, and that's just what we're hoping to deliver. Solutions to move forward during the COVID-19 pandemic, and Saki will talk a little bit about that later on. and of course, the better understanding of EnVisions and health centers. Also, we've got some health center and EnVision Center partners on the phone from Mississippi, Connecticut, Kentucky, and West Virginia. So we're happy that there's some folks out here who are already partnering well. Next slide, please. Just a little background. Community health centers have been around for a long time, and currently there are about 1,400 federally qualified health centers serving 28.4 million Americans with over 11,000 sites. And of the 1,400 FQHCs or health centers, there are about 385, so about a quarter of them that are in or accessible to public housing, and those health centers serve about 4.4 million patients. Of those, there are 107, so within that group, there are 107 public housing primary care grantees, and they're funded specifically to provide service to those who live in or immediately accessible to public housing. And they serve about 817,000 patients. And overall, health centers employ nationwide over 200,000 staff, and I think the number's up around 236 or 240,000. So it's one of the largest providers of healthcare in the nation. Next slide, please. And some key health center characteristics. Health centers have been around for about 50 years, beginning in 1965 with health centers in Boston and Mon Bayou, Mississippi. They now serve about 1 in 12 Americans, most below the poverty line and paying with Medicaid. And of course, you see the characteristics. They are non-for-profits generally, though some are actually public. Provide a comprehensive scope of services located in or near a high-need community, medically underserved area, and govern with community involvement. The board must be 51% patients or from the community, and treat parties regardless of ability to pay. And important for us is that the program is focused on public housing residents. Health centers are near public housing in underserved areas, and there are many long-standing relationships with public housing agencies and health centers. So we want to kind of reinforce and enhance and grow those relationships. Next slide, please. Health centers offer what is referred to as a patient-centered medical home, and I'm not going to get into the heavy detail on it, but basically you're looking at comprehensive services: physical health, mental health, oral health, prevention and wellness. The care team may include physicians, nurse practitioners, physician's assistants, nurses, pharmacists, nutritionists, social workers, educators, care coordinators, community health workers. Services may be in-house or through partnerships and virtual teams. And of course, telehealth has grown tremendously a lot of it due to the COVID experience. They're patient-centered, which is to say they're relationship-based with an orientation to the whole person, partnering with patients and the families, understanding of patients' unique needs, cultures, values, and preferences. And the care is coordinated across the broader healthcare system, including specialty care, hospitals, home health care, and community health services and supports. Communication is key, particularly in times of transition when patients are discharged from the hospital, for example. Accessible services with shorter waiting times, enhanced in-person hours, 24/7 electronic access to care and electronic communication options. Include mobile units or enabling transportation supports and home-based care. Telehealth services are now available. In fact, when this was initially done, it was over 90%, and now it's over 90% of health centers are offering telehealth services. And there's quality and safety, committed to quality and safety all the way through. The programs are evidence-based, and there is a lot of oversight and regulation and continuous improvement and sharing of quality and safety data across the board. Next slide. EnVision Centers and health centers are very, very often near one another, and those make the partnership a little bit easier. In other cases, there is some distance, and we'll talk a little bit about that as we go along. Next slide, please. Whereas there are the 42 EnVision centers currently, and the goal to go on to more. Right now, across the country. As you can see, there are numerous, those red and blue dots are health centers and housing agencies. And obviously with 1,400 health centers, 11,000 locations, and 3,100 approximate public housing agencies, there's a lot more of that. And we want to encourage those partnerships, and again, to also enhance the EnVision Center Initiative as well. Next slide. The impacts of housing on health are reflected in the social determinants of health. And we'll talk about this a little bit more because we think there's such a close relationship between the social determinants of health and EnVision Centers and what they're trying to accomplish. But as you can see, if you take a look at this slide, I mean, there's such a tight relationship between social, economic, and environmental factors. You know, water quality, air quality, housing and transportation, you know, job opportunities, economic opportunities, quality of care, and so on. And these are, when you look at the pillars of EnVision Centers, what it's trying to address as well. Next slide, please. As far as the health picture of HUD-assisted adults, this is a publication done in combination between HUD and CDC using the National Health Interview Survey and the National Health and Nutrition Examination Survey combined with HUD administrative data. And it's probably one of the best studies out there or documents out there to give you an understanding of where housing residents, public housing residents, and HUD-assisted folks across the board fare in terms of their health condition. And across the board, they are not doing as well, obviously, as the national average, you know, in terms of fair health or obesity or having a disability or diabetes or COPD or asthma. And these are the chronic conditions that health centers are working so hard to address. I know many housing agencies and EnVision Centers are trying to solve as well. Next slide, please. Somebody asked earlier about COVID-19, and we have been trying to track COVID-19 through our health centers. As you can see on the right side, obviously a number have been tested, and I guess one thing that is is not surprising at this point to a lot of folks involved in public health, but it's still disturbing the large percentage of positive tests for those who are racial or ethnic minorities. And that's obviously a source of great concern and something that people are trying to get to the root cause of and address. And something that health centers and housing agencies can work together on. Next slide, please. And why should we partner? Well, to reduce and eliminate those barriers, partnerships between public housing agencies and public housing primary care health centers and other health centers are ideal for addressing causes of health inequities such as education, housing, neighborhood environment, and employment opportunities. And working together, we can align our agendas and integrate our approach to delivering services. Just communication and awareness is a place to start, and then you can go from there to improving healthcare delivery, to trying to address the social determinants themselves. Next slide, please. HHS, which funds and regulates health centers, has made enhanced population health and addressing health disparities through community partnerships one of its top 5 goals for the next 3 years. These partnerships must include PHAs and FQHCs and many more, including EnVision Centers, as well as state and local public health departments, schools, social services, law enforcement, job search and job training organizations, transportation, faith-based organizations, and many, many more. Next slide. Do you want to go with polling question 1?
Sure. So right now I'm going to go ahead and show our first polling question. So are you currently engaged in a collaboration with a health center, EnVision Center, or public housing authority? And please select all that apply.
This is a big issue for us. We're very interested to see where everybody stands on that, and it will kind of help us all, I think, as we attempt to work together.
All right, so 61% said yes with an EnVision Center, 58% said yes with a public housing authority, 39% said yes with a health center, and 18% not at this time.
Okay, good. Okay, okay, next. Okay, so I'm going to walk you through just a couple of examples that have improved access to healthcare, senior health programs, and access to behavioral health services. Just an idea of some of the different types of collaborations, because there are really so many different forms, but these are some, I think, examples. And these come from a mix of qualitative research and projects that we've done at NCHPH. Okay, next slide, please. City of Chicago and the Chicago, in the form of the Chicago Housing Authority, working with TCA Health, a federally qualified health center in Chicago. They were having difficulties engaging residents and getting folks registered for health insurance and health education sessions and so on. And so CHA and TCA went out and actually found a resource, a grant, and went out and got some money to fund a position for an outreach worker at their site. And by doing so, the impact was terrific. They enrolled 1,000 folks in insurance and health education sessions, and they've kind of continue that relationship, and there's a great exchange of information between the health center and the housing agency and the residents, just on an ongoing basis. So a great success story. Next slide, please. In Chicago, we had the city of Chicago, partnering between the Olivia Medical Center and the Resurrection Project. And we had, Resurrection looking to come up with some additional affordable housing, and Olivia, looking to provide more care, and the city kind of supporting all of it. And so by working together, they were able to, one sold some of the land so the other could put up the housing, and within that they actually included a clinic, and it includes a lot of specific services for seniors and monthly wellness programs, benefits enrollments, achieving 2,400 folks getting enrolled. So again, a great success in Chicago. And the last one I'm going to touch on today, which is the next slide, goes to Flint, Michigan, and this was a project of the Genesee Health System, which is a public housing primary care grantee in Flint. And interestingly enough, in looking at some of the court data, they found that a number of folks in the area that were coming in for drug and related issues were patients of Genesee, and among them many public housing residents. And so they actually funded a position to actually be on site in the court system, and they went through the records on a regular basis and an ongoing basis, and got those folks into treatment, and minimized their involvement going forward with the criminal justice system, and went and took care of more of the treatment issue. And as a result, they had an 80% reduction in recidivism and $500,000 savings in jail costs, and a 50% reduction in psychiatric and subacute detox services. So just an excellent program. Okay. Getting into EnVision, it is a program, just let's say, that we have been involved with in some capacity, I guess, since its inception and some of the early work in Detroit. It's obviously it's something of great interest to us because these are the folks that we serve. It was geared to those in lower income and public housing residents and so on. And the measures, prenatal visits, increasing prenatal visits, annual physicals, hearing and vision screenings, lead-free homes with children, veteran enrollment, and screening for blood pressure, diabetes, glaucoma, cancer, and lead. All things that we have, promoted and worked toward, and just something we support. And Saki is going to go in just a minute and kind of go through in some detail some ways to try to achieve some of those goals. Next slide, please. Okay, EnVision Centers are a very diverse group, as you know, and some of you may not know, so that's why I'm mentioning it. Some of them are in smaller cities, some of them are in larger cities. I mean, so you've got some in Philadelphia and Chicago and so on, and you've got some in some of the smaller towns in Kentucky and Hickory, North Carolina. And so they have very, very different issues. So next slide. And I'm not going to go through these. This is actually just a list of some of the original EnVision Center grantees. And I just say that there are different circumstances for different sites. For example, California and San Diego, they had a pretty good relationship between the health center and the housing agency and the workforce agency, and they've furthered that, and so they've had a pretty good partnership. Similarly, in Spokane, Washington, I think they've had great success for the same reasons. Next slide, please. Michigan, which was the initial site, is kind of an interesting one from the standpoint of a health partnership, because they're different circumstances. Detroit proper, there was a health center in downtown Detroit, pretty close, and they have established a relationship or enhanced a relationship. In Inkster, which is a small town right outside Detroit, the Wayne County Health Center and the Inkster Public Housing Agency, Inkster Housing Commission, had a relationship, but it had kind of fallen apart a little bit, and so they've put that back together a little bit. And now, and the one I'm going to mention and talk about a little more is Detroit and Life Remodeled, because Detroit and Life Remodeled is a nonprofit organization, does great work in Detroit, and is the lead for an EnVision Center at a former school there in Detroit. But there were some complications with it, and I'm just using it as an example of some of the issues that may face some folks as they go forward. Next, could you move 2 slides up? Okay. The Durfee Community Innovation Center is run by Life Remodeled, the nonprofit. And within that area, as you can see there, you see it with stars, Family Medical Center of Michigan and St. John Community Health Investment Corp. You also see the Wellness Plan and Covenant Community Care. Well, St. John is not a federally qualified health center. Family Medical Center of Michigan is, as is the Wellness Plan and Covenant Community Care. Now, the area around Durfee is a little bit of a kind of in the middle of everyone's turf, so to speak, and so it presented some challenges. Covenant and Community Care and the Wellness Plan Medical Center and Covenant were very interested, but it was really just too much because they had recently done new access points, and they just couldn't do it. So what ended up happening is St. John and Family Medical Center, which are school-based programs in a school next to the Durfee Community Innovation Center, actually have formed the partnership. Although these folks are still looking for a longer term and maybe a more a deeper level of service, because a school-based program does not have quite the hours of operation, and access to it is a little bit limited. And so they're looking to expand, and as far as I know at this moment, they're still trying to enhance that. So, as I said, the partnership thing is not as easy as it sounds, but it's worth the effort. Next slide, please. And so in the end, you ended up with Family Medical and St. John partnering with Durfee Community Innovation Center. Next slide, please. This slide is really focused on the issue about collaboration. 64% of health centers inaccessible to public housing have collaborative agreements with PHAs, or at least they did when this survey was done a couple of years back. And that's a good news, bad news situation. It's great that 64% do, but it also means 36% or over a third don't. And we really want to improve on that. We find that a lot of times those relationships, those personal relationships are key. And when there's turnover, sometimes those relationships fall apart. And so we would really like to find a way to solidify those and enhance those. Next slide, please. At this point, Dr. Cho is going to take over here and run through our elaboration recommendations. Go ahead, Saki.
Hi, I'm just waiting for that little note that says I'm going to control the slides or to share my screen. There we go. Can you guys see my screen?
Yep.
We can see it.
Okay, great. Thanks. Sorry. So thank you so much. As Bob mentioned, we are working on a guide to help EnVision Centers and health centers develop partnerships to support EnVision goals. The document is forthcoming, but I just want to highlight some of the content and echo a lot of what Bob said, which is that health centers are natural partners for EnVision Centers because there's so much synergy in their mission and goals. And the EnVision Center Initiative in many ways addresses the social determinants of health because of its central focus on education and income, which are key to achieving good health outcomes, and because it so clearly calls out the importance of health and wellness. The two ways that I think health centers and EnVision Centers can work together is to focus on the economic empowerment goal and the health and wellness goal. As Bob mentioned, health centers are an integral source of local employment and economic growth in many underserved and low-income communities. The TCA Health and the Chicago Housing Authority example that he mentioned showed how their partnership resulted in the hiring of 2 public housing residents. And we think that there's an opportunity to do some more training and hiring of staff, particularly community health workers. And I don't know how many of you guys on the call today are familiar with community health workers. They're referred to in a number of ways. Sometimes they're called promotoras, CHWs, health advisors, health educators. Essentially, a CHW is a frontline public health worker who is a trusted member of the community or someone that has a very close understanding of the community served. And they perform a range of activities, outreach, community education, informal counseling, social support, advocacy. We at NCHPH have had an opportunity to work with the National Alliance of Resident Services in Affordable and Assisted Housing, NARSA, who I'm sure many of you are familiar with. These are the group of resident leaders that sit on resident councils at public housing authorities. And they have always been very receptive to learning and passing on health education, whether it's diabetes prevention or management or mental health and substance use disorders. So one way to engage in a partnership that could build individual and community capacity, as well as improve health knowledge and self-sufficiency, would be through a job creation or a training initiative that focuses on community health workers with resident leaders. It doesn't have to be that specific, but there's also that potential there with that ROS funding. And then the other more obvious ways to work together is to focus on the health and wellness goal. And these are the sample goals that HUD has outlined for EnVision Centers. And 2 of them call out FQHCs outright. But there are other goals that could benefit the health of the local housing community in a meaningful way. And a health center partner could help EnVision Centers identify those goals and help evaluate whether those goals are being met. Another obvious way is to focus on the COVID-19 pandemic issues, including education on prevention, testing, and treatment. So as I mentioned before, the guide that we're developing has some key points to consider when identifying a health and wellness goal. And again, I'm just going to go over the highlights. The first step is to be aware of the national data that Bob described earlier that points out the health issues that are the most prevalent among public housing residents, like diabetes, asthma, smoking. And an option is to base your goals on those key health conditions. So some examples could be on decreasing the number of residents with uncontrolled diabetes, or increasing the number of adults with a healthy weight plan if they're overweight or obese, or how many individuals are receiving smoking cessation services or are screened for mental health conditions. These are all services that health centers provide. So working with a health center to determine which patients are public housing residents and then tracking those indicators could be a part of your health and wellness goal. But there may be some local health data in your community that shows, that actually there are a few things that are really important for your community. Maybe the opioid crisis has hit the developments hard, or there's a lot of crime and violence, like in the Flint, Michigan example that Bob mentioned. So you would choose to focus on behavioral health goals. Or maybe there are pockets of high COVID-19 rates that are affecting specific neighborhoods in your city, so you'd like to focus there. There are a lot of local data sources that exist, and the guide shows EnVisions where they can go to get that local information to help inform their decisions on what goals to pursue. And so some of those sources could be from your local or health state department, from community needs assessments that are done at your local hospital, or you can visit the County Health Rankings and Roadmaps program. It's a project from the University of Wisconsin and the Robert Wood Johnson Foundation. They pull together a lot of health and social determinants data at the county level. And then the 500 Cities Project, which is a collaboration between the CDC and the Robert Wood Johnson Foundation that provides city level data on a number of indicators that might be of interest to you. Another approach could be to think in goals in terms of the pressing social determinants of health in your communities. Is access to healthy food an issue? Is it having a safe place to exercise a problem? Is it transportation? Is it education? Your goals could extend to those areas as well. And some resources to help you get a better understanding of how those social determinants of health are affecting your local communities could be through that County Health Rankings and Roadmaps program that I mentioned earlier, or you could go to our website. We have interactive maps that include many health, behavior, and social determinants data, as well as the geographic locations of health centers and public housing authorities and development sites and the EnVision Center sites. And I'll tell you a little bit more about that later, but that's another resource. The next step is having a health partner at the table to provide counsel and guidance on how to prioritize what health area to focus on, as well as help you all understand what is measurable and what is likely to have impact over the short and long term when it comes to health outcomes. To do that, it's helpful to create a formal relationship through a memorandum of understanding, or an MOU, that outlines roles and responsibilities for each organization. MOUs usually contain the purpose and the principle of the partnership. It defines common terms, the funding, the duration of the partnership. There's more information on how to find partners and how to create an MOU in this guide, as well as another report that we did called Cross-Sector Collaborations. But another example is to use a lease agreement, which is what the Chicago Housing Authority did with TCA Health on the previous example that Bob mentioned. So that lease agreement outlines some of the same types of parameters that are on an MOU, but the difference is in the Chicago example is that they just leveraged the space that the housing authority had available in their buildings. So it was essentially providing a room to allow health center staff to come and give health education and support at no cost. So for them, a lease agreement is what made the most sense. Another challenge that organizations often face when they're trying to engage in partnerships for the first time is that they are unsure who they should contact and reach out to in an organization. So it makes that first step that can turn into 3 or 4 phone calls or emails trying to figure out who the right person is. And that can be frustrating and time consuming and sometimes can act as a real deterrent in getting things started. So to help with that, we have created a directory of EnVision centers and health centers located at EnVision sites. And this includes contact information for all organizations for the current 42 EnVision sites. And this is going to be a living, breathing document. We'll update it periodically as more EnVision centers get named. There's also the HRSA's website, Find a Health Center, and using their map, you can find health centers in your location. And then we also have maps, as I mentioned earlier, on our website as well. But we are considering taking things a step further and building a portal off of the NCHPH website where EnVision centers, health centers, and public housing authorities would be able to log in and communicate with organizations in their area, learn about who is available and willing to, in their community, to partner, what services they can provide or need. And maybe a future step would be to have a forum for organizations to communicate and share challenges and best practices and like funding mechanisms, that sort of thing. We haven't created this yet because we aren't sure if people would use it, if it's available. So our next polling question is, if we build it, would you use it? And so Fide, can you put that polling question up?
Sure. Coming up right now. So would you use a portal dedicated to partnerships for EnVision centers, health centers, and public housing authorities? Okay, 66% said yes and 34% said maybe.
Okay, great. It's good to know as far as whether or not we should devote the time and the resources to building that type of portal. Okay, so the next couple of items that I want to mention as far as steps to choosing a health and wellness goal is the importance of engaging the community. Engaging the public housing community is, and any community, is critical to knowing whether or not you're really addressing the health needs of the community. A lot of times research and data will point us in one direction, but the residents really are the best test for knowing whether or not you're moving in the right direction. And it's important for achieving goals, and it's also important for building trust. And then finally, evaluation. It's often an afterthought, but it's very important to understanding the impact of your work and where and how to improve for the next round. Monitoring and evaluation plans should include things like the goals, the targets, the health indicators, the data sources, the data collection periods, analysis plans, organizations that are responsible, and the timelines for completing the project. So we talked about a little bit about how to choose a goal for health and wellness. And I want to talk about another publication that we're working on, which is how EnVision centers and health centers can work together to address one of the sample health and wellness goals that was outlined by HUD, which is increasing prenatal visits at health centers. While all of the sample goals that were outlined by HUD are great and could benefit health, maternal and child health and well-being is really critical for public housing residents. There are 700 women that die each year as a result of pregnancy and its complications, but Native Americans and African Americans are 2 to 3 times as likely to die from a pregnancy-related cause than a white woman. Infant mortality rates are also higher in racial and ethnic minorities, and as you're aware, public housing residents are disproportionately racial and ethnic minorities. And this variation in mortality indicates that more can be done to understand and reduce pregnancy-related deaths. One option is to improve access to prenatal care. And for mothers in public housing, routine cervical cancer screening and prevention that can occur during the prenatal visits is also important. We know that 93% of cervical cancers could be prevented with timely cancer screenings and vaccination. So this report does a couple of things. It gives an overview of the number of women that are getting prenatal care at health centers, during what trimester that care is being delivered for the first time, and then the race and ethnicity breakdown of their prenatal care patients. It also gives state-by-state maps on locations of EnVision centers and health centers, and you can see I've highlighted some from the regions 3 and 6, DC, Delaware, and Texas. And it also provides some of the data I mentioned about at the state and the individual health center level, so that EnVisions have a good sense of the baseline and where to set goals. So this publication is forthcoming, and once it's complete, it'll be available on our website. But if you sign up for our newsletter, you'll be notified as soon as it's available as well. So just in some summary points on tips as far as developing a partnership goes. The first step is to identify a partner, make sure you're addressing the same populations and population needs, explore the types of services that health centers can provide, establish goals, develop MOUs or other formal agreements. And that could also include serving on each other's boards or advisory groups, and then evaluate and revise your goals for continuous improvement. And I should mention though, that these tips are pre-pandemic tips. The landscape looks a lot different now because health centers, as well as many of you on the call, have been operating in this full crisis mode, trying to deliver services with limited staff and limited supplies, and this kind of constant changing guidance and regulations, and the 24/7 attention to COVID and the challenges. So as you enter into partnerships, I think we should have expectations that it might take a little bit longer to get responses and get things started. But one way to help move that along is to think of ways and look for ways to help support each other's goals, because you really are caring for the same populations, and there often is a synergy in your goals and the challenges that you face. And if it were me, I would focus on the most obvious issue, which is COVID-19. So how can you work together to increase education on how the virus is transmitted, how to prevent transmission, what to do if you think you've contracted the disease, where to seek care, dispelling some of the myths about treatments. And then once vaccination has been developed, you could work together on getting those immunizations out in the community. One of the startling findings from our analysis of the COVID-19 data that Bob mentioned, but it's worth mentioning again and again, is the rate of infection among racial and ethnic minorities, particularly the Latino population. From week to week, we've seen the rates of infection among minorities been as high as 84%. This past week, as Bob showed you, it was around 70%. And of course, this is really important for housing authorities as well. So if you approach it in those terms, I think you might get a faster response. And then once you've developed a partnership and figure out, how to deliver vaccinations, then you can pivot to increasing access to other childhood immunizations or lead screenings, or then focus on some of those important chronic health conditions that public housing residents face. So anyway, that's what I would do. I would go for that low-hanging fruit first, and then build from there. And with the understanding that, building partnerships does take time. And so setting reasonable expectations and follow-up and communication engagement. So I just wanted to quickly show you, this is the interactive map that we have on our website. And it'll show you where EnVisions are located, public housing developments are located, the location of health centers, as well as some of that health data that might be of interest to you, diabetes, health behaviors, some of the social health outcomes, socioeconomic health factors that are affecting public housing residents. And then this is the HRSA's Find a Health Center website, where you can enter your zip code, and all of the health centers within a 5-mile radius will display. And that is all I have for me. So Fidi, I think you have another polling question.
Okay, so for this polling question, would you be willing to enter into a partnership with the Health Center, EnVision Center, or PHA if you have not already done so? All right, so 100% said yes.
Great. Fide, do you want me to hand this back to you, or do you want me to go through the slides?
I think it would be better if you could go through the slides.
Okay. All right, Bob.
Okay, thanks, Saki. Thanks, Fide. Just a summary of kind of broad recommendations. Obviously, you know, and this is kind of part of that effort today, collaboration.
Bob, I think you're muted.
Hey, Bob, I think you're muted.
Yeah, thank you. So I think accidentally I got muted by the organizer. But anyway, these are just some general recommendations, and thanks, Saki, for kind of that detailed review of some of the steps. Today's session is an example of kind of that beginning, that collaborating with communicating, educating, engaging, and prioritizing. Establishing those reciprocal partnerships, which Saki mentioned, are critical because we've seen a lot of turnover in both the health centers and housing agencies, which really dramatically impacts the relationships in a time like now. And especially, you know, Saki was talking about COVID and such a challenging time for both health and housing. And, you know, one example of that, and something that, you know, we can all work on together, and I know the world is working on it, is relative to telehealth. And there are just a lot of challenges for residents, particularly if they're elderly or disabled, if they don't have the equipment or they don't have the know-how. And those are issues that, you know, can work on together. And in terms of, you know, one thing that was common for a lot of people during COVID was food and food distribution. A lot of health centers, for example, have you know, food programs. And a lot of health centers used their food programs as a touch point to check in with their patients. And health centers, I'm sure, did the same with other food providers for residents. An environmental scan and asset mapping is always a great place to start. Engage the community together, whether it's the PHA, the EnVision, or the FQHC, or other community partner to strengthen numbers. Whether it's you're dealing with the federal government or you're dealing with local communities, it really helps to work together and to coordinate activities. And some ideas, you know, use the annual resident meeting or the lease signing to refer residents to health centers and to kind of, you know, share that as and likewise health centers can refer their patients for housing to housing agencies. And to leverage all the resources you have, whatever it is, big or small. And case management is something across the board that I think that is really a crying need. You know, and if that's something that could be built into EnVision Center, you know, so much the better, because it's how do you tie all those things together? I mean, people have specific health needs or housing needs or educational needs, but they also have basic enabling service needs, you know, transportation and babysitting and all those things. So, you know, working together can really make a difference. And we would like to, and this is part of that, to partner and promote EnVision Centers. But we would also really like to make sure that we firm up those old relationships and enhance and build new relationships relative to health centers and housing agencies, particularly at a time where there's been some changes in public housing, and you know, a lot of it of affordable housing is through housing choice vouchers and RAD developments and so on, and it's a slightly different relationship. But we need to work together to make sure that people are getting the services they need, whether they're health or social services or education and transportation or a myriad of other services. And in terms of, next slide, in terms of partnership opportunities, EnVision Centers support and promotion, you know, is obviously number one. Public housing and health center partnerships, ensuring health of residents impacted by changes in public housing, as I just mentioned, and cross-sector collaborations with other organizations. And I think there is a great opportunity, as Saki mentioned, you know, kind of brilliantly, around COVID-19. It has been the, you know, the dominant issue that we've all been facing. And I think, you know, at the same time, probably, you know, next up is, and an ongoing issue has been issues around structural racism and health equity, and how we make sure that gets done in a very real and lasting and beneficial way. So I think those are some of the priorities for all of us. Fide?
Yes. Saki. Okay, so right now we're going to enter a Q&A session. So if you would like to ask the presenter a question, please submit it through the questions box on your control panel. And if you're dialed in through your telephone and would like to verbally ask the presenter a question, use the raise hand icon on your control panel and your line will be unmuted. So we have one question, and this question is from Jose Ibarra. We have been working with multiple centers in Gary. Is it recommended to stick to one or have multiple partnerships?
Hi, this is Bob, and actually it can work either way. There's no limitation on it. There's room for a lot of creativity. You know, in reality, this program is maybe not in its infancy, but maybe you've got a toddler, not even at this point. So there's just an opportunity for growth and for trying new things, and really either situation works. And a lot of it just has to do with logistics. And if you can get, you know, two centers that are interested, it, you know, doubles your capacity. And, you know, some of it may depend on logistical concerns, you know, proximity between the health center and the housing agency. But congratulations to you for reaching out and getting those partnerships together. Anything else, Fide?
Not at the moment, Bob.
Okay. Okay.
We have one that just popped in right now.
Sure.
So this question is from Johnny O'Brien. How are current health centers and public housing dealing with crime and safety in the current environment of law enforcement and building that trust with the community?
Fide, do you want to take that one? I'm sorry, Saki, do you want to take that one?
Sure. So, I mean, I think about the Genesee Health Systems example. So some health centers have done these training programs with their police force on how to identify when someone in a citizen is really having a mental health issue. So they go through these mental health first aid trainings. That's been happening in North Carolina and in Michigan. And that has been a way to kind of learning some de-escalation techniques, learning when maybe you should be calling a healthcare provider instead of calling the police force to deal with some sort of potentially violent eruption. And it's been a lot of education and a lot of communication between health centers and the police force and community members with the resident councils on, having some types of open forum. And this has been, the examples that I'm mentioning are in a publication that we developed on community violence. It's available on our website. But this was before well, maybe not before the issues with the police, but at least before it became such a large part of the media. And so I think there's more things probably happening on the ground. But again, there are police trainings that are available to help them understand mental health and substance use issues that could prevent arrests and get them into programs that are more helpful and keep situations from escalating into becoming more violent in the neighborhoods.
Any other questions, Fide?
Not at the moment.
Okay. Well, if we have just a moment, I'll just say that we're kind of coming to the end of our time together today, and I'm hoping that there'll be a great deal of follow-up to this. So we will, based on I think the results today, go forward with trying to develop a portal to help people form those partnerships. And I think we'll be reaching back to folks if they're interested. For example, we have an advisory group, and we have had, we have health center members and a couple of public housing members. But if folks would be interested in joining that, you can send an email to me directly. Or you can really send it to any of us. If you, in the last slide in the presentation, you'll see our email addresses and all that great stuff, because we're very interested in getting input from housing agencies and EnVision centers as well. Also further, if there are specific, if any of you on the EnVision Center side are in search of a partnership and would like some assistance, we'd be willing to provide you some assistance. And also, if you have, or any of the folks have any success stories that they'd like to share, we'd like to contribute to building those best practices. And across the board, for resources, you can visit our website. We have learning collaboratives, webinars, publications, provider and resident fact sheets, newsletters, mapping, annual symposiums. Our annual symposium, unfortunately, was canceled this year due to COVID. We think we're probably going to have to go virtual in the year to come. But if you look at our site, we will be publishing notices on that, and we really look forward to that. And public housing and other community partners have always been a big part of our training symposium or conference, and we hope to continue that in the future. Next slide. And Saki, do you want to just say a few words about this, since you guys put so much work into it?
Well, Fide really should take credit for this, but these are some of the infographics that Fide and our staff have put together on providing information to public housing residents on COVID-19. These are available on our website in English and Spanish, and are really great printables that you can place if you're in a housing authority around your buildings to help spread the word on prevention and knowing the basics and knowing how to seek care.
Right, and you can also follow us on social media, on Twitter and Facebook, and our YouTube channel as well. And people will be able to get the slides from this presentation as well, following it. And Fide, do you want to tell them how to do that?
Sorry, Bob, can you repeat that again?
Do you want to just tell the folks how to get copies of these slides if they so desire?
Yes, so we will be sending a link to all the attendees, and that link will give you access to the slides and to the recording.
All right, cool. Well, thanks very much for joining us. That concludes our webinar for today. And we look forward to working with you on the health center side, the housing agency side, and the EnVision Center side. Grow the program and form better relationships between all of us to improve the quality of life and self-sufficiency and health of our residents and patients and across the country. Take care.
Thank you.